paying for your Jardies, Farxiga, Steglatro, Invocana? These names sound familiar to you, and you're paying. You have high pay for that. And they are supposed to be indicated in people that has diabetes. They are all the same. They are they are called SGLT2. These inhibitors are very important. They were the new generation. Metformin is not longer the most important thing. Is these diabetics has heart problems. Most of the diabetics, most of them has some heart problem. Then these SGLT2 inhibitors came forward. But I have an article here, and I put it there in my social media, and it says, this is called POEMS, Patient-Oriented Evidence That Matters. It's from the American Family Physician. SGLT2 inhibitors, Jardies, Farxiga, Steglatro, Invocana, reduce cardiovascular mortality, but benefit is modest, even in patients with established heart disease. And you will say, well, why I'm paying for it? Bottom line, here is the most important thing of this toxic environment that we are in the United States. A 14% reduction in cardiovascular death and a number needed to treat of 200 patients for 3 years to prevent one death was reported with SGLT2 inhibitors. How many people do we have to treat? 200 patients. For how long? 3 years to save one life. But that's not only important. And you will say, well, if it's my life, well, sure. But remember that we took this to the level of this will save the life of people that has cardiac disease and are diabetics. Do we have to change that and says, if you eat correctly, if you decrease your weight, if you exercise, if you, instead of medication, in one, they said there's no significant reduction in myocardial infarction or non-fetal stroke, although cardiovascular death were significantly reduced. 0, 86, 95%, no one understands this. But the absolute reductions are less impressive. The authors make it difficult. This is the American Family Physician commentary about patient-oriented evidence that matters, and says the authors make it difficult to calculate them, reporting only relative values such as heart rates. For cardiovascular death in patients who mostly has established cardiovascular disease, mortality in the placebo group was 4.1% overall in median 3 years study. Applying this in the treatment group for an absolute reduction in mortality of 0.5% and a number needed to treat it, as I say before, is not marketing. That you do not allow inside the study to show then you only have a little result, and you send this to everybody, we find something unique. Be careful. This is the American jungle of health, or worse, the American jungle of disease. They are making money with your disease. I hope that you are able, if you want something that will truly improve most of your systems, you need something that I can tell you and I can show you clinical data, not 200 patients, 3 years. Things that are, imagine that the immunocal with 4 patents, one for cancer, one patent for the side effects of chemo and radiation, the other for HIV, and the other for neurodegenerative disorders. And we are still taking this at this price? Take your time. I'm Dr. Scholcoff. I'm a former associate professor of clinical family medicine at Northwestern University. Please leave your comments in my social media. Thank you.